Hello, and welcome to your first Changed class. We are so glad to have you join us for this program. My name is Jennifer, and I'm going to be your facilitator for session 1, Fight for Your Life, You Against Cancer. Today's class will be about 30 minutes. You're going to need your participant manual. You should have received one at your enrollment appointment with us. Your manual looks like this. Now, this is your book and you're free to keep it, take notes in it when we go along together through it. So maybe go ahead and grab a pen if you don't have one and you're going to be ready to go. Now, I'm going to ask you to go ahead and turn over to session 1 with me. While you're turning to session 1, let me go ahead and tell you some of the main things that we're going to be learning together today. So first, we're going to discuss an overview of the Change Initiative. Then we'll learn about what cancer is. We'll talk about what health disparities are and how they can affect not only the state of Georgia, but also the African American community. We will even see how these health disparities can affect different forms of cancer, including prostate cancer, breast cancer, and colorectal cancer. Most importantly, today we'll talk about what modifiable and non-modifiable risk factors for cancer are. We're even going to be taking a look at some of the personal risk factors that you may have. We'll finish the class today by talking about different cancer screening tests and recommending screening intervals. So if you're ready, go ahead and turn to session 1 in your participant manual. Okay, so who created Change? The Change Initiative was created at the Georgia Cancer Center in Augusta, Georgia by Dr. Marlo Vernon. Change stands for Cancer Health Awareness Through Screening and Education. The Change Initiative is a Georgia Cancer Center at Augusta University community-based program. The initiative is designed to improve cancer care and reduce racial disparities and inequities in a community collaborative manner. The goals of the Change Initiative are to increase awareness of cancer risk, increase cancer prevention and screening behaviors, provide health literacy and education with an emphasis on changeable risk factors, increase community awareness of cancer-related resources in the CSRA, and to connect people to high-quality cancer screening and early detection services. This is important because many people are unaware of the screening recommendations and screening resources. As a result, they are diagnosed with late-stage cancer and are more likely to die from the disease than others. I'll have you now turn to page 3, and we're going to look at the 4 class sessions that we'll be taking together. So the 4 class sessions of the Change module include Fight for Your Life, You Against Cancer. For session 2, we look at breast cancer, colorectal cancer, and prostate cancer. And session 3, we'll talk about risk factors. And then session 4, we'll dispel some cancer myths and talk about cancer care connections. Look on page 4 now. What is cancer? So cancer is a condition in which abnormal cells divide without control. Cancer can develop in organs, glands, and systems like the lymph and blood. The body is made up of many types of cells. Cells normally grow and divide in a controlled way and produce more cells as they are needed in order to keep the body healthy. When cells become old or damaged, they die and are replaced with new cells. Look on page 5. You'll see a graphic that shows normal cells and cancerous cells. I'm going to give you just a few minutes to write down some of the differences that you may see between these normal cells and cancer cells. Okay, so maybe you noticed that the normal cells are all the same shape and size. They're all uniform and in a line, well contained in that tissue, where the cancerous cells are of different shapes, different sizes, and they've had extended outside the tissue. That's what we look for when we're looking at cancer cells. Turn now to page 6. So how does cancer develop? So cancer is a genetic disease, meaning it is caused by changes to genes that control the way our cells function, especially how they grow and divide. These genetic changes can occur because of errors during cell division, damage to DNA by harmful substances such as chemicals from tobacco or too much exposure to ultraviolet rays from the sun, and genes inherited from our parents. The body normally eliminates cells with damaged DNA before they turn cancerous, but the body's ability to do so goes down as we age. This is part of the reason why there is a higher risk of cancer later in life. Go ahead and turn the page. So when we think of cancer, we usually imagine a growth or a tumor, but there are actually two forms of cancer, both solid and liquid. Liquid cancers are detected in blood and bone marrow. An example of a liquid cancer would be leukemia, also known as blood cancer. Solid cancers often form tumors or clumps of cancerous cells. These are detected using medical machines like a CT scan or MRI. It is important to note that not all tumors are cancerous. Tumors can be both benign or malignant. Benign tumors aren't cancerous. They can often be removed, and in most cases, they do not come back. Although benign tumors may grow into nearby tissue, they do not spread to other parts of the body. Malignant means the tumor is cancerous. Cells in these can spread to nearby tissue and eventually may spread to other parts of the body. The spread of cancer from one part of the body to another is called metastasis. We want you to remember that when a cancer cell spreads, it is still the same cancer as where it started. For instance, if a person has breast cancer and it spreads to the lung, it is metastatic breast cancer, not lung cancer. This fact is important for doctors because it will determine how they treat the cancer. Turn now to page 8. So here we see cancer incidence and cancer prevalence. So incidence is the number of new cases, and prevalence is the number of new and existing cases. There's a bathtub image there on page 8, and that demonstrates perfectly this prevalence and incidence. So the new water coming in from that faucet would be the incidence, and the water already in the tub is the prevalence. You do see that there's some water leaking out, and that's mortality, which we'll talk about in just a minute. Look at page 9 now. So it's likely that all of us know someone with cancer. There's an estimated 40% of people who will be diagnosed with cancer sometime during their life. New cancer diagnosis and deaths are actually decreasing in the United States and Georgia, which is good. We do show statistics there for you that in 2021, there were an estimated 58,000 new cancer cases, or about 159 per day, and 17,760 cancer deaths, or 49 a day in the state of Georgia. In the state of South Carolina in 2021, there have been an estimated 33,000 new cases and 10,940 cancer deaths. It's important to know that these numbers are all forms of cancer. Now, we do see that there are some differences in the rate of new cancer diagnosis and deaths, particularly between African American and white people. In Georgia, African Americans are more likely to get cancer and are more likely to die from the disease. There are differences which are called health disparities, which include personal behaviors and cancer screenings that can affect the rates of cancer. It's important to know that avoiding behaviors that put you at risk and detecting cancer early are the keys to changing the face of cancer. Now on page 10, we're going to talk a little bit more about what these disparities are and what they look like for different populations. So many groups across the United States and around the world suffer cancer-related disparities. Race or ethnicity, gender identity, age, disability, socioeconomic status, and geographic location all contribute to a person's ability to be healthy. Let's take a look at how health disparities affect cancer outcomes. You should see a table on page 10 that shows overall cancer health disparities in the U.S. for each race and ethnic group in the U.S. from the year 2020. As we mentioned earlier, incidence there means the number of new cases. In this table, I'll have you look at the column labeled incidence. These numbers show that for every 100,000 people in the US, there were more new cancer cases in Black or African American compared to whites. Now let's look at the death column. That's mortality, which shows the cancer death rates. We see that more Black people have died from cancer compared to white people who have died from the same disease. In Georgia, African American males are diagnosed and will die from cancer 25% more than white males. This difference also exists between white and Black women. African American women are at a 13% higher risk of cancer death than white women. Again, we know that this is a health disparity. Let's turn now to page 11. So disparities exist within different types of cancers as well. Look at the graph from years 2013 to 2017. These are the incidence rates of prostate cancer in the US. You can see Black men have the highest incidence rates, meaning they are at an increased risk of developing prostate cancer compared to men of any other race or ethnicities. Although deaths from prostate cancer have dropped substantially among all men, Black men are still twice as likely as white men to die from prostate cancer, and they continue to have the highest prostate cancer mortality among all populations. Look at page 12. We'll talk about the disparities in breast cancer. About 1 in 8 women develop invasive breast cancer over the course of their lives. On the incidence graph, we can see white women and Black women do have similar incidence rates. However, on the mortality graph, Black women have a much higher mortality rate. Now, despite having similar rates of breast cancer, Black or African American women have a higher mortality and are more likely to die because of the disease. Now, there are many possible reasons for this difference in survival rate, including differences in tumor biology and tumor genetics, prevalence of risk factors, including overweight and obesity, barriers to quality health care access, a lack of health insurance, health choices, including not completing treatment, and later stages of diagnosis. On page 13, we see that colorectal cancer disproportionately affects the Black community as well. In this graph, we see Black people have the highest rates of new cases and deaths of any other racial or ethnic group in the US. African American men are noted there to have the highest rates of colorectal cancer, where African American women have the highest rates of colorectal cancer compared to any other race of women. Although health disparities are a very complex matter, one thing we do know is that part of the cancer differences relates to a person's personal behaviors and cancer screening behaviors. Again, avoiding behaviors that put you at risk and finding cancers early are the keys to changing the face of cancer. Now we're on page 14 together, and we're going to look at some of the factors that increase your chance of getting cancer. Scientists study risk and protective factors to find ways to stop new cancers from starting. There you see that anything that increases the chance of developing cancer is a cancer risk factor. In general, risk factors can be grouped into 4 categories. We have those listed there as behavioral, environmental, biological, and genetic. Behavioral risk factors are those associated with things that you do, such as smoking, your diet, and your physical activity. An environmental risk factor are those associated with work exposures, pollution, secondhand smoke, and others. Biological risk factors are those that would be related to your age or to your gender, where a genetic risk factor is related to your genes and your family history. Okay, so I want you to think about a minute these risk factors. We do know that some are either modifiable or unmodifiable. So a modifiable risk factor, something you can modify, would mean something that you can change. So take just a minute and maybe think, is a modifiable risk factor something you can or can't change? Circle that on your page. So then in contrast, an unmodifiable risk factor. This would be genetics and family history. So are those things that you can or cannot change. So an unmodifiable risk factor cannot be changed. Then let's think. Does changing a modifiable risk factor increase your chances of developing cancer? Yes, we know, because a modifiable risk factor is something that you can change. Then that would mean you can decrease your risk of developing cancer if you were to change that risk factor. So an example of a modifiable risk factor, something that you can change, would be your behavioral risk factor. So remember, we said that smoking would be a risk factor, so you can change that. You can make the decision not to smoke, thus reducing that risk factor for you. Okay, let's look at page 15 now. So scientists have found certain things that are known to increase the risk of cancer. These things that can increase the risk of cancer are tobacco use, infection, radiation, and immunosuppressant medication. Which of these do you think is the strongest risk factor for cancer? It is tobacco use. We did list that as number one because it is the number one risk factor for cancer. Tobacco use is actually linked to 40% of all cancer diagnoses. Tobacco smoke contains at least 70 cancer-causing chemicals known as carcinogens. This means that every time you breathe in the smoke from a cigarette, these carcinogens enter your bloodstream and can go damage the DNA of your cells. Remember, we said that damage to the DNA of a cell can cause the cell to become abnormal and be cancerous. Many people only associate lung cancer with smoking. However, smoking can cause many types of cancer. Tobacco products, including cigarettes, cigars, e-cigarettes, vapes, dip, and snuff, cause almost 9 of every 10 cases of lung cancer, but smoking can cause cancer almost anywhere in your body. Not using tobacco or quitting smoking lowers the risk of getting cancer. Let's look at page 16 now. So there is an image there for you on page 16 that highlights how tobacco can cause cancer throughout your body. Some cancers that are associated with tobacco use are lung, leukemia, bladder, throat and mouth, kidney, pancreatic, and stomach. Now look at page 17. So another known risk factor for cancer is infections. Research also has shown that infections from viruses and bacteria can cause cancer. Examples of cancer-causing viruses and bacteria include human papillomavirus, or HPV, which is spread sexually and increases the risk for cervical, penile, vaginal, anal, and throat cancers. Hepatitis B and C viruses increase the risk for liver cancer. Helicobacter pylori bacteria is a stomach infection, which increases the risk for stomach cancer. H. pylori infections are treated with antibiotics. HIV infections weakens the body's immune system and increases the risk for several cancers, such as lung, cervical, and non-Hodgkin's lymphoma. There are 2 vaccines that help prevent infection, thus lowering the risk of cancer. These would be HPV vaccine that's recommended for boys and girls ages 11 to 26, and the hepatitis B vaccine. The third known cause of cancer is radiation. To protect yourself from radiation from the sunlight, all people should limit sun exposure from the hours of 10 a.m. to 4 p.m. Secondly, all people should use sunscreen, including people of color. For radiation exposure during medical procedures, patients are protected from medical tests. Healthcare providers only order medical tests when the benefit of the test is greater than the risk of having the test. They also avoid ordering unnecessary medical tests. Lastly, the fourth known cause of cancer is immunosuppressive medications. Doctors follow patients who are prescribed these medications closely. In review, what are the 4 categories of cancer risk? I'll give you time to answer. I hope you've written down behavioral, environmental, biological, and genetic. One more question. What are the 4 known causes of cancer? We talked about tobacco, infection, radiation, and immunosuppressive medications. Now I'll have you turn to page 18. So we just discussed those 4 known risk factors for cancer. Now we're going to look at some of the risk factors that may increase the risk for cancer. These factors aren't known to cause cancer, but they are commonly associated with an increased risk. And these are obesity, diet, alcohol, physical inactivity, environment, and secondhand smoke. We'll start with weight. So overweight or obesity. Now, weight that is higher than what is considered a healthy weight for individuals given height is called overweight and obesity. Doctors can determine this by using what's called a body mass index or BMI, and that's a screening tool that's used for overweight and obesity. For adults, a person with a BMI of 25 to 29.9 is considered overweight, and a person with a BMI that is 30 or higher is considered to be obese. You may be surprised to learn that being overweight or having obesity is linked with a higher chance of getting 13 different types of cancer, including prostate, breast, and colorectal cancers. Let's look at page 19 now and see how can obesity cause cancer. So obesity can cause changes in the body that can lead to cancer. These changes include long-lasting inflammation, a higher than normal level of insulin, insulin-like growth factor, and sex hormones. These risks increase when a person gains more weight or is overweight for a longer period of time. So we see that a diet in high-fat foods may increase your risk for cancer, and a diet with fruits and vegetables, especially non-starchy vegetables, can actually help protect cancers. All right, turn now to page 20. So studies have shown that drinking alcohol may increase the risk of oral, throat, breast, colorectal, and liver cancers. Research also shows that people who are physically active have a lower risk of certain cancers than those who are not. Some environmental exposures, including exposure to air pollution, asbestos, and arsenic, may also increase your risk of developing cancer. The last cancer risk factor is secondhand smoke. Secondhand smoke contains more than 7,000 chemicals. We already know that at least 70 of these may cause cancer, again, carcinogenic chemicals. Many adult non-smokers die because they breathe secondhand smoke. The U.S. Surgeon General estimates that living with a smoker increases a non-smoker's chance of developing lung cancer by 20 to 30%. Important to know that there is no risk-free level of exposure to secondhand smoke. You'll see highlighted there that anything that increases your risk of getting a disease is called a risk factor. Also, having a risk factor does not mean that you'll get cancer, and not having a risk factor doesn't mean that you'll get cancer. So keep that in mind as we move towards completing your personal cancer risk analysis. This will help you identify your risk factors, including your lifestyle behaviors and family history of cancer. Now, one of our staff should have gone over your personal cancer risk form with you when you enrolled. What I'm going to do is give you a minute. You can go ahead and pull those out. You can go ahead and start looking those over. Sometimes those take a little bit of time to complete. So maybe at the end of this class, at the end of this video, just give yourself about 10 to 15 minutes to get that completed. Again, if you have any questions about your personal cancer risk analysis form, you can either email us or call us. We should have given you that contact information. If you don't have your forms, you can let us know. Okay, so we're going to move on now to page 22 if you want to go ahead and turn that there. So there are some signs that are commonly seen in people with cancer. Caution is a helpful way to remember these cancer warning signs. These include C, change in bowel or bladder habits, A sore that does not heal, U, unusual bleeding or discharge, T, thickening or a lump in the breast or elsewhere. I, indigestion or difficulty in swallowing. O, obvious change in a wart or mole. N, nagging cough or hoarseness. Please note that sometimes people with cancer have no symptoms at all, and that many people experience these caution symptoms and do not have cancer. We do recommend that you follow up with your healthcare provider if you are experiencing any of these symptoms. Okay, so now we will talk about how to prevent cancer. Did you know that you can reduce your risk for cancer? Cancer prevention is any action that is taken to lower the chances of getting cancer. Scientists work hard studying many different ways to help prevent cancer, including ways people can avoid or control things known to cause cancer, ways to help people change their diet and lifestyle, ways to find precancerous conditions through early screening and detection, and chemopreventive medications, which involves the use of medicines to treat precancerous conditions or to keep them from turning cancerous. Look at page 23 now. We're going to talk about cancer screenings. Cancer screening tests are helpful and important if you have a history of cancer in your family. Cancer screening helps detect cancer early and will improve cancer outcome and can be quick to obtain, inexpensive, available, and safe. Page 24. Cancer screening tests different from cancer diagnosis tests. Screening tests look for conditions before there are symptoms, while diagnostic tests are done after a person has symptoms. Let's look at the recommended screening intervals. The table on the following pages will display cancer screening recommendations for the different cancers by the American Cancer Society and the U.S. Preventive Services Task Force. These intervals and age ranges are based on research on the population-based average risk person. Some of the information differs. It is best to choose a screening interval that fits you and your lifestyle. The first table is a screening interval for colorectal cancer. As you can see, compared side by side, some of these preferences differ for screenings. However, they remain around the same time frame. So looking at the table, after age 50, how often should individuals get a colonoscopy? Write your answer there. Now let's move on to the next table. This table displays screening intervals recommended for breast cancer. At what age and frequency does the U.S. Preventive Services Task Force recommend a mammogram and a clinical breast exam? Write your answer. Now, the final table shows the recommended screening interval for prostate cancer. Looking at the table, how often does the American Cancer Society recommend the PSA blood test? Great. So now that we've looked at those recommended screenings, what I'll have you do is turn all the way to the back of your book. You'll see a table there that's listed Session 1 homework. You can take that out. It's easier to have it out because you'll actually need these two tables to complete your chart there. So what we want you to do is to look to see what screening recommendation is recommended for what form of cancer. So if we want to get screened for breast cancer, what test or procedure is recommended for that? So a mammogram. So we would write breast cancer screening, mammogram. Next, we want to know, when was your last one? Let's say I had my mammogram last year, so I would write 2022. We're going to do the same thing for colorectal cancer screenings and for prostate cancer screenings. After you have that table filled out, we want you to hang on to it. This is yours to keep. We'd like for you to have a conversation with your doctor based on what you see on these tables. So if you realize that it's been 5 years since your last mammogram or a PSA blood test, it may be time for you to go ahead and get yours. So you can go into your doctor's office and say, you know what, I've taken a cancer awareness class. I've realized that I'm overdue for a cancer screening, or even if you've not had one done, then this gives you the opportunity to have that conversation with your doctor about getting a screening done. Now, we are able to provide referrals if your doctor would need a referral to make sure that your screening is taken care of. We can do that for you. Also, if you don't have a primary care doctor that you see, that could do that referral for you, we can also get you arrangements made through one of the health departments to get some screenings done. The main thing is that we want you to be aware of when these screenings are recommended for you, and that you have a conversation with one of your medical health professional team members, and to make sure that you are current in all your screenings that are recommended for you. So you should have our contact information still. If you would like a referral for any type of screening, please just let us know. So that is it. That is the completion of session 1. You should have an email that will contain your session 2 video. If you haven't received that yet, it should be coming next week. If you do not receive it, please reach out to us and let us know. Again, if you have any questions about any of the information that was discussed in today's class, or if you would like a referral, you can email us with our contact information, or even call us here at the office. Thank you.